In Canada, the physician can directly euthanize a patient. I'm not sure what's going to happen now, but in the past, in the states where physician-assisted suicide was legal, the physician handed you the stuff and you had to do it. I remember watching a video where a woman, she had a terminal illness, she was on the younger side, but she decided in Oregon to do this. They gave her the stuff to take home. That kind of sets better for me. I don't know how I feel about the idea of the physicians doing it directly. In Canada, there's some physicians who have euthanized over 400 patients in a year. I read that it comes down to 81 physicians euthanizing about 15,000 people a year in Canada. And I don't know, that to me mentally, that if I were a physician, I don't know how I would feel about directly injecting. Feels when someone gets the death penalty. And I don't know how I would feel about that. Where in the United States, it's at least up until now, I'm not sure what's going to happen in the future. They provided you the means to do it and you did it on your own. How do you feel about that?
So I think along the same lines of what you're saying with it's almost going against the Hippocratic Oath, right? That doctors have to take or physicians have to take. Okay, it's still a treatment, but it's an ending a life treatment. So I don't know, and that I would be, as a physician, comfortable doing that for patients. Now, I imagine that not every physician is mandated in Canada to offer these services, but if they're
Of course,
directly pushing the drugs, they're the ones that are ending the life or what have you. I feel like there's probably a pretty big ethical weight that goes along with that. And I would be more in favor of what happened in Oregon. We might have seen the same video of that female.
Yeah, it was a few years old.
Yeah. I think that just for the mental health of physicians and their practice, I'm not a huge fan of how Canada does that. I would think that the better option would be having and it gets sticky when you have someone with dementia, but like having, I want this, I'm going to take it, it's on me because I'm physically taking whatever drug to end my life. Now it's on me. That guilt is not on the physician or the pharmacist or whoever that would be pushed. If a person is okay with that, if a physician is okay with that, maybe, but I just don't see long-term how that would be mentally healthy.
Also, the perception in the public, we were talking about COVID, and there's a lot of lingering remnants of that. I think a greater distrust.
Yeah.
And once you cross that line where now physicians can directly, I don't even know what the language should be. I want to say terminate, but that's euthanize. In my head, I'm like terminate, euthanize. I'm sure you've had your fair share of DNR, DNI patients, and it's decided, and their blood pressures going down and the heart rate, and you're giving them morphine to make them comfortable if it seems like they're in pain. But there's a natural process. Like no one's going in there and injecting somebody with something that will cause them. So that's a whole different thing. Go ahead.
I think the concern there is if you're enabling physicians to do this, there's a concern with people that are poor, their quality of life sucks. They keep having these comorbidities that are driven by their socioeconomic status. Okay, now are you just enabling this to kill off the poor?
And that goes back to the Canada case, the suicide of Sophia, who's not alone in this case, where, to sum up, she had a condition where she was hypersensitive to things, smoke and mold and whatnot. And she put in for specialized housing, but couldn't get it. And she became a candidate for the physician-assisted suicide. And that's what they did. Like you said, because once you go there, now you're opening up a doorway and
setting a precedent.
And it could feel like that, and it could be perceived like that. And in this case, there's a lot of questions. Why did that happen? She didn't have a terminal illness. She was just seeking specialized housing. And yes, maybe she was suffering so much that it was a good idea, but it was also because you couldn't find her housing. Find housing.
I think reading that, it's like all she wanted was better airflow. It was something pretty basic.
Yeah. It's 2026 now. I think we all live in the real world, even in medicine. A lot of it's about the numbers. It's about what's cost effective. Is it more cost effective to euthanize somebody than to work and get them the specialized care that they need? That's a horrible conversation to even have. I would do everything I can for the latter. To euthanize somebody over their socioeconomic status is abominable. The easiest way to get around something is to legalize it and then come up with all of these shortcuts around it.
Yeah.
If this becomes the law of the land, how quickly are they going to be able to put amendments in there in case of this or in case of that, or if this happens? And it's like, that wasn't the original intent,
Yeah.
but now you've legalized it and you've created all these loopholes.
Yeah.
That's been my experience. It's like, you want to get around something, legalize it.